The coronavirus pandemic has tanked the global economy with unprecedented speed. Millions out of work, markets plunging, business slammed to a screeching halt. Here's what you need to know to understand this economic turmoil we're living through.
Hey guys, welcome back to my channel. So who am I and why am I making this video? My name is Dr. Lindsay Butzer and I work in South Florida as a veterinarian. I make YouTube videos and I run my Instagram account, Lindsay Butzer DVM. So why am I making this video? So I'm making this video because there is a coronavirus pandemic going on right now in the US. And the second reason is that I have some anxiety built up about this because 4 months ago, I was diagnosed with cancer, with acute lymphoblastic leukemia. And going through my chemotherapy treatments during a pandemic is something that is very terrifying. So I wanted to share with you guys what I've been going through, and I want to let you know that we will all get through this. We just need to be strong and be safe and do our social distancing and keep our loved ones protected. So a stressful event that I had to go through was being tested for the coronavirus before I started my 4th round of chemotherapy. They wanted to make sure that I didn't have it because of everything going on, because the chemotherapy is very hard on your body, and I wanted to make sure I was negative before starting. The coronavirus test doesn't come back for 48 hours. So for 2 days, I was hospitalized just waiting for the test to come back. And a side effect of chemotherapy is having a sore throat, sometimes a runny nose, and I had developed a dry cough because here in Houston, Texas, it's allergy season right now. And I was just panicking that I had contracted the virus. But 2 days later, it came back negative and I started my chemotherapy. So for me, going through chemotherapy during COVID-19, one of the scariest things is that in the middle of my cycle, my white blood cells are completely wiped out. My bone marrow basically gets wiped out. That means my white blood cells, platelets, and red blood cells all can go to 0, meaning I have no immune system and no defense against anything. So for about 5 days, I was terrified against my own body getting an infection, plus having to deal with the outside world and contracting a virus. So right now, during the coronavirus, what I'm doing to stay safe is I am staying isolated. I haven't left this apartment for about 30 days, but the only times I do leave is to get blood work done, which they draw through my pretty PICC line here, because I have to know my values. I have to still go to doctor checkups, and at MD Anderson in Houston, Texas, they are taking a ton of precautions. There are policemen, there is screening being done, so I feel pretty safe going in the hospital. They also are not allowing visitors, so only the patient, so only myself can go. I used to have my mom and my boyfriend go with me, but now it is just strictly patients that can go into the building. The other thing about groceries is what everyone asks is I do not go get groceries. My mom or my boyfriend will go, and then we just disinfect the area. We use sprays, wipes. My mom wears gloves and a mask to go grocery shopping, and then we just respect the social distancing, so staying at least 6 feet or more away from people. And then another personal thing to keep myself safe during chemotherapy and COVID-19 is no sharing drinks with your loved ones, no kissing, none of that. You have to be completely isolated, and that is the only way you're gonna keep yourself safe. Here is me in isolation, sleeping. That is basically all I do is rest during chemotherapy and then Google about the coronavirus and get myself scared again, and then just continue to stay isolated. Alright guys, thank you for watching this video on how I've been dealing with my anxiety through COVID-19 and going through chemotherapy. I've been staying isolated like all of you guys have been, and I have 6 months more of treatment at MD Anderson where I need to still go into the hospital and practice my social distancing and self-protective habits like wearing gloves and a mask. So I still have a lot more to go. I'm just gonna take it one day at a time, and that's all we can do. If you like this video, hit that subscribe button and remember to hit the bell to get notifications for when I post videos.